Heart disease is the leading killer of men and women in the U.S., and it's all the more reason to brush up on your heart facts during this February, which is American Heart Month. Dr. Amandeep Dhaliwal joins us from Mercy Cardiology Clinic. Thanks for coming in today.
Thank you for having me.
We're going to do something a little fun. You brought with you a quiz to test our heart health. So go ahead, let's start this quiz.
All right, so question 1. Which of these is not a typical sign or symptom of a heart attack? Shortness of breath, pain in the jaw, toothache, or chest pressure?
Now, I didn't cheat or look any of these up.
Okay.
And I think this is kind of a tough question. I'm going to say, though, C, a toothache.
Okay, cool. So basically, when you have chest pain, when you have shortness of breath, and it lasts for longer than several minutes, those are symptoms that may be consistent with heart attacks. So, you know, seek medical attention.
Sure. If you have any of those symptoms. Okay, let's go to the second question.
Which of these is not a major risk factor for heart disease? A, high cholesterol, stress, heredity, or smoking?
I would say either A or B, but I'm going to say stress.
Okay.
Is that right?
So there are basically risk factors that you can modify and risk factors you can't. And essentially, you're born with being male or female or your age, and so you won't be able to change those risk factors.
Sure.
Family history is something you can't do anything about, but there are some modifiable risk factors. So if you had high blood pressure or high cholesterol or diabetes, those are things that you could modify, smoking even.
Sure. So if stress were to impact your blood pressure, for example, that might be something that would be considered a risk factor, but it's not a direct risk factor for heart disease. Okay, let's go with our third question.
Okay. Most healthy Americans should eat less than 1,500 milligrams of sodium a day. How much do you think Americans on average are getting? 1,500, 2,300, 3,400, or 5,000?
I like salty food. Not great for me, I know. I'm going to go midway. I'm going to say C, 3,400.
Yes, correct.
Wow.
The long and short is there seems to be a correlation between how much salt you consume and what your blood pressure is. And so, you know, the general trend is eat less salt and hopefully less blood pressure. And
there are foods out there that you see on the labels, they say lower sodium.
Right.
So it is recognized by the food industry that we need to watch our sodium intake.
Correct.
Okay, we got 2 more questions to go. Let's pop up the fourth one.
If someone you're with is experiencing signs of a heart attack, you should drive them to the nearest hospital, call 911, tell them to lie down and rest, keep them talking and walking. I'm
going to say call 911 and let the experts do their job.
Well, yeah, correct. So the long and short is you want to give the ambulance a call simply because if they are able to activate certain services at the hospital, they can activate the cardiac lab, they can activate certain services, for instance, transmitting an ECG for diagnostic purposes, starting an IV, giving you aspirin, giving you an IV fluid. So they can do a lot of things that we would normally start in the emergency room.
They know what they're doing.
Correct.
We're going to squeeze in one last question. We are almost out of time.
Okay. What is door-to-balloon time? Time for balloons to be delivered, time for fingers to swell on a walk, time to go outside and yell for help, time to get an ER patient to the cath lab. I'm going to say it's D. Yep, well, the longest answer. So basically, time is muscle, and that's why you want to get the least amount of time here. And Mercy has an excellent process. We've beaten the national standard of 90 minutes for at least 5 years. Sure. Well, you can find more about heart health at Mercy's website. Just go to mercycare.org/heart for more information. Dr. Dhaliwal, that was fun. Thank you so much for coming in today.